we're going to talk about transvaginal exams today. Some indications for doing a TB include abnormal bleeding, pelvic pain, first trimester pregnancy, and suspected abortion, and follow-ups for other findings. What we are going to use in lab is a wedge, and we're going to cover the wedge with a drape. Have the patient put their bottom on here to elevate the pelvis. If you're at a hospital or somewhere that has feet stirrups, that's the best way to do it, and they can slide towards the end of the bed. But for today we're going to be using the wedge. So the reason that we use a wedge when we're doing the transvaginal is for hand manipulation. You need to be able to see the superior portion of the uterus, the lateral lay of the ovaries, and when you do that, you know, your hand's bumping into the bed and you're not able to really manipulate the probe very well. So we're going to prepare our transvaginal probe for the exam before the patient gets settled in. Always wear gloves when you're handling this. Okay, in lab we have these sheaths. We have to put gel into them. You might get lucky and at your clinical site they have ones that already have the gel in them, which is really nice, but just squirt the gel inside. Slide your probe into the sheath. Okay. Slide it down, and then while you're getting that on there, some of your gel is going to slide down. So just bring it back up, make sure all of the air bubbles are out, and you'll see on the screen there's no air bubbles. Take your rubber band, flip the rubber band over to hold the sheath in place, and your probe is ready and you are ready to get your patient settled in. Before you start the exam, make sure you put enough gel on the outside of the probe as well. Hi, so I understand you come in for some pelvic pain today. Okay, so what we're going to do is a transvaginal exam. I'm only going to put about 4 inches of the transvaginal probe inside. We're going to check out what's going on, and then you'll hear from your doctor in about 24 hours with any results. What I need you to do, I'm going to step out, take everything off from the waist down. There is a sheet on the bed, just cover up with that and we'll get it started, okay? All right, thanks. Okay, so now the patient is situated on the wedge. Her pelvis is elevated. That way my hand has a lot more room to move around to image all of the structures. Now when I'm to insert the probe, I'm going to hand it to the patient. I'm going to hand you the probe underneath the sheet. I need you to insert. Pause. So after we're done with our exam, it is time to clean up. Take the sheath off, throw it away, wipe it with a dry paper towel very well.